Hi everybody, my name is Luke Lavallée. I'm a urological oncologist at the Ottawa Hospital. It's a great pleasure to be here today. I'm really impressed by the turnout and by the incredible organization that's gone into this event, and thank you for allowing me to participate with you today. So I'm going to talk a little bit about developments and current practice in prostate cancer imaging. First, a disclaimer, I am not a radiologist, who are generally the experts in performing imaging, but I am a physician who orders a lot of imaging and who uses it and interprets it a lot, and therefore I think I'm in a fairly good position to try to speak to you about it today. I'd like to start with a case that may be familiar to some people in the room. This is a 65-year-old healthy man who was found to have a PSA of 10 on screening because he followed Dr. Kajianos' advice. And he came in, met a urologist, was properly counseled, and had a prostate biopsy performed with ultrasound guidance. And the prostate biopsy was negative, which could be very good news. 6 months later, however, he was followed up by his physician still, and the PSA was 12. And a common question in this scenario may be, Doctor, how do you know that the prostate biopsy that I had really did a good job of sampling my prostate and making sure that there's no important cancer there? And so this is a question we ask ourselves a lot in clinic, and we want to make sure that this biopsy did not miss potentially important cancer, and imaging may have a role in this. So why do we image the prostate? Well, there can be many different reasons to do so. You may image the prostate to determine if there is a cancer present, to determine if a known cancer, that is one that's already diagnosed, requires treatment, and to help you plan your treatment. And you could do so to determine if a cancer has spread outside of the prostate, either locally outside of the capsule, or more distantly, for example, to bones, lymph nodes, or other organs, because this will very much affect the treatment that you're going to recommend. So what type of imaging techniques are we talking about? Well, you can use an ultrasound to help guide a biopsy. You can use a CT scan to help view if the cancer has spread outside of the prostate. And these are two technologies that I think most of us are probably quite familiar with because they've been around for some time and they're frequently used. We can also use a bone scan to see specifically if the cancer has spread to bones. Next, we could use an MRI, and this is a somewhat more recent technology and one that I'm quite excited about developments in technology for, because MRI has shown some promise over recent years in looking at if cancer has spread locally outside the prostate and helping us identify cancers inside the prostate for treatment planning. And it also does give us some idea about local spread. Or a PET scan, which can, in very specific circumstances, possibly show us the location of the cancer and if it has spread outside of the prostate. So I wanted to talk to you today about a few specific kind of innovative or more recent developments in imaging technology because the theme of today is kind of what are exciting new developments in prostate cancer treatment. So one is MRI, and this is something that some of you might have had a discussion with your physicians about recently. We are more and more now using MRI to improve biopsy accuracy. I wouldn't say that this is appropriate for all patients at all times, although it may be in the future. But in patients like the one presented in our case, who an initial biopsy was performed and was negative, and there remains some diagnostic uncertainty or some concern regarding the risk of prostate cancer, an MRI may be appropriate to help us identify if there's a significant cancer that was missed. And here, for example, the MRI, you can see identified a lesion in the prostate, which is highlighted here by the arrow sign, and shows us that there was maybe something that was missed. And using this MRI and ultrasound technology, we could perform something called effusion biopsy, where we try to target a cancer that was visualized on MRI on a subsequent biopsy to make sure that we have not missed any important cancer. So this is a way that imaging may improve the sensitivity and specificity of some of the testing that we perform and make for more accurate testing for patients and also less side effects. This is an image here that shows some fusion technology where we combine MRI and ultrasound technology to identify lesions and target them on biopsy. And this type of technology, which is quite new, is actually hopefully coming to Ottawa in the very near future. We can also use MRI prior to surgery. For example, if a patient has made the decision to proceed with surgery for an important cancer, we sometimes order an MRI in certain scenarios to see if the cancer has spread outside of the prostate. And if it has, we can try to alter the surgery or modify our technique to remove all of the cancer. So for example, here this circle outlines the general area of the prostate in the body. And the MRI might identify a lesion as so that is seen both in the prostate and slightly escaping from it. And if we identify this, and if we can do so with some accuracy, then we may be able to alter our dissection technique to go more widely around the cancer in this location to avoid leaving any cancer behind and to give the patient a better chance of cure in the future. A second new technology I wanted to touch on today, Dr. Breaux already mentioned a little bit, and I think this is an exciting technology that we may be using more in the future, and this is PET scans. As Dr. Breaux mentioned, PET scans use a special molecule that is specifically designed to target certain types of cells, and in this case, prostate cancer cells. We then tag the molecule with a specific radio tracer, and the tracer causes these cells to highlight or come out of the image. So here you have a normal cell, which I highlighted, which does not bind the molecule, whereas you have a prostate cancer cell the molecule binds to and the tracer lights up. And so using special PET scanning technology in certain circumstances, not in all, but in certain circumstances, this could be advantageous for identifying the cancer within the prostate. For example, here, similar to an image Dr. Breaux showed earlier, and here again inside the prostate, or sometimes in a more distant location, for example, in another organ. And if you were to identify cancer in another organ, this would potentially alter your treatment plan, and so this could have an important role moving forward to ensure we're treating the right people. We are currently participating in a randomized trial examining the utility of PET scanning for patients with prostate cancer. And I think that it's very important before we roll out any technologies like this that we evaluate them, because with every new technology that comes out, there is the potential to have unintended consequences or unintended findings, and therefore we have to very carefully study them before we roll them out in the entire population. So what is the future of prostate cancer imaging specifically? Well, I believe very strongly that the future lies in and will be dictated by research. I'd like to reiterate what Dr. Breaux and what all of the speakers have said so far, that research is critically important in determining how we adopt new technologies and new testing moving forward, and we're very committed to doing that in Ottawa. Specific imaging technologies or techniques that may help us in the future that I wanted to kind of give you a sneak peek at could be something called 3D printing, which you might have heard about in the media over recent years. 3D printing uses special technology that allows you to, instead of creating like a 2D image that I've shown you so far, such as the MRIs or the CTs that you look at in one plane, 3D allows you to see in multiple dimensions, and we can actually print out organs that you can then use to help plan a surgery, for example, or radiation that you're giving, or any type of treatment. And so this may be coming for prostate cancer. Here you see an image of a prostate located here, and then a 3D printing model that shows you the prostate and then potentially the cancer on the inside. So this is not something that is currently being used, but something that might be developed and assessed over the coming years. A second new technology that is up and coming is virtual reality. And I actually have a video that we'll see if we can play here in a moment that can show you some applications of virtual reality. This isn't it. Think it should work? It may not work here. We'll see if we can get it loaded up, but essentially virtual reality would allow a surgeon or even a patient to hopefully get a better understanding for how the anatomy internally looks. This could help with planning of surgery. This could help with education to reduce variability in care, and this may give patients and their families a better understanding. Oh, here we go. A better understanding for what their anatomy looks like and then what the procedure that's planned may be. Okay, we can go ahead and start. So this is just an example. This is not a prostate, but this is an example of how virtual reality can be used to examine organs inside the body in different ways. And as you can imagine, you could use technology like this to try to explain either to medical trainees or to patients and their families how the relevant anatomy is oriented and how surgery will be planned and carried out. Patients could even have a chance to wear these neat goggles, which would be fun. Okay, so we'll go back to the presentation. So these are just a few kind of sneak peeks at what the future may hold for imaging. I think that we're constantly making developments in this domain, and imaging is certainly an area that is rapidly progressing, as we've seen in society and certainly in medicine in general. So I'll thank you very much for your attention, and I'll be happy to field questions after during our panel discussion.